Hi friends, as winter is approaching, let's talk about a common question: how to take care of heart patients in winter. So friends, let's try to understand what are the physiological changes that happen during the winter time or when one is exposed to cold weather. Firstly, when there is cold weather or low temperature, the blood vessels in our body contract, and this is called vasoconstriction. Because of the vasoconstriction, there is a rise in blood pressure which puts an extra stress on the heart. Some studies done have also shown that compared to normal people, the people who have known blockages in the blood vessels, when they are exposed to cold weather, the blood flow to their heart further gets compromised compared to someone who has normal blood vessels in whom the blood flow actually improves with cold weather exposure. And thirdly, friends, we have some enzymes in our body that are called coagulation factors, which help to clot the blood and thin the blood. When there is excessive cold weather, these enzymes can be temperature sensitive and they can work differently or abnormally in excessive cold weather and lead to clotting, excessive clotting and thickening of the blood, which can also predispose someone to a heart attack or increase in blockages. So friends, with these physiological changes, what are the symptoms that we expect to see in our patients? In the winter time, if you have known blockages, you may have worsening of your symptoms if you are exposed to cold weather because of the rise in blood pressure, reduced blood flow, and excessive pressure on the heart. Secondly, friends, your blood pressure that was controlled during summertime may increase in the winter time. And thirdly, you may be more prone to clotting. So what should we do if you are already diagnosed with a heart condition? In the winter time, my friends, it is very important to stay warm, stay indoors in the winter time if you have a heart condition. Do not do heavy exercise in very cold weather outside because of the reasons that we just discussed. There can be reduced blood flow to your heart, and in fact we see very commonly in our practice that during the winter months when people are shoveling snow early in the morning, it's really cold outside, then they are prone to heart attack. So if you have a heart blockage or heart disease, please try to stay warm and do not do excessive heavy exercise in the cold weather. If your blood pressure is being treated, if you have hypertension, make sure you're checking your blood pressure every single day during winter time, as it can increase because of the vasoconstriction, and it is important to keep an eye on it. The other thing I would like to mention is that do not drink alcohol and go outside if you are a heart patient in winter time. The reason is that alcohol can give us a false sense of being warm even when we are in cold weather. So you can be in cold weather, feel warm because of the alcohol, but you will still get the deleterious effects of cold weather. So try to stay indoors, try to stay warm as well, and do not drink excessive alcohol before going out. Lastly, if you are having more symptoms, more chest pain, or your blood pressure is uncontrolled, then your medications may need to be adjusted according to the weather, and therefore please don't hesitate to call your cardiologist or your doctor to see if any medication changes need to be made. I hope this was helpful, and if you have any other questions for me, please feel free to comment. Thank you.